Hello and welcome to News Across Nigeria. I'm Olumide Macaulay. Coming up on the program, several homes go up in flames in Dagaru village in Bauchi State. Edo State's government steps up efforts to enforce its environmental laws. And police in Osun State confirmed that the explosions in Ile-Ife was caused by an improvised explosive device. Prior to that disclosure of the reason for that explosion in Osun State, there were many theories, but that's put paid to that. We'll bring that story for you later on in the program. We begin where many residents of Dagaru village in Katagum local government area of Bauchi State have been made homeless after a fire destroyed almost all the houses in the village. Reports say the fire started from a kitchen in one of the houses and was able to spread quickly owing to the inflammable thatch used as roofing. The Bauchi State government has promised to provide relief materials for the victims.
This is what is left of Dagaru village in Katagum local government area of Bauchi State after an inferno engulfed the community. Burn found produce, household items littered here and there. Residents are now homeless, and the despondent look on their faces say it all. The materials used for the building did not help matters. Mud houses with thatch roofs are susceptible to fire.
I lit fire to cook, then the wind started blowing. Unfortunately, the fire blew to the thatched fence of my kitchen. I tried to put it out, but it was beyond me. Before I knew it, it started to spread.
When we couldn't contain the fire, we reported to the fire service station in Azare. It took 4 trips before they finally put out the fire.
But succor has come their way. The state government is here to sympathize with the community.
We sympathize with them, and of course we also warn them how to behave these days. It's very windy these days, and most of the houses are thatched, and playing with fire is going to be very dangerous this time. We warn them. It's something they know, but just bring it to the attention closer. Now, and the government, we have already started acting, because this is an issue that doesn't require delay at all. So we promptly brought for them at the moment what they need immediately. That is food, clothing, shelter.
Bauchi has only 3 fire stations across the state, and this is grossly inadequate to fight the fire outbreaks, especially in rural areas like Dagaru. This incident should be a wake-up call for the establishment of more fire stations.
Meanwhile, promoting the efficient sharing of information among the youth may be crucial to stopping violent extremism in the northeastern states. This formed part of the solutions offered by participants at a discussion in Yobe State seeking to end the insurgency in the region. The forum was organized by the Presidential Committee on Northeast Initiative with support from the Victims Support Fund to educate youth on how to use media to disseminate information that will enhance development.
Whatever you are doing, wherever.
Access to information is considered a key component to development. Another important aspect is proper communication of ideas, beliefs and values to enhance all-round human capital growth. In troubled regions like the northeastern part of Nigeria, sharing information is crucial, especially in tackling violent extremism. That explains why the Presidential Committee on Northeast Initiative and the Victim Support Fund decided to gather youths in Yobe State to enlighten them on the importance of the new media in changing the public perception, especially in countering hate speeches.
One of the major reasons why the Presidential Committee on the Northeast Initiative is doing this training is to enhance the skills of young people in the Northeast for them to be able to report activities happening around them better. if you take a look at the Northeast, you'll discover that it's a region that is referred to as a media black hole. We have taken it upon ourselves to train young people on the use of new media so that they can better report humanitarian conditions and developmental strides in their environment for the generality of Nigerians in a better way.
The committee has also identified the importance of youth as major tools for change, and it believes that the new media has been used to deceive, delude, and influence them negatively.
When people, everyday people, take up their phones to tweet, to make a Facebook post, to talk about something online, to share WhatsApp messages, that they will be sharing from their experiences, they'll be sharing constant things happening around them without fear, without adding things that are not facts to them. They'll be able to go online and see stories that are false and counter them immediately.
I find this workshop very beneficial to me because I've learned a lot. For example, I've learned how to ignore some faulty news on social media or scam.
The Presidential Committee on the Northeast Initiative, in collaboration with the Victim Support Fund, has over the years been playing an active role in tackling problems of war in troubled areas, particularly in the resettlement of displaced persons within and outside of the Northeast region.
To the south and the health sector, the Cross River State government has kicked off the construction of 3 referral specialist hospitals across the 3 senatorial districts in the state. The projects are being built in Etong, Obudu and Akpabuyo under the state's insurance health scheme tagged Ayade Care. When complete, the facilities are expected to boost medical care and ensure universal health coverage to registered persons with a token sum of 1,000 naira monthly.
The ongoing construction of the Ayade Care referral hospitals in 3 of its senatorial districts across the state promises to be another boost to the medical tourism drive of the state government. The Commissioner for Health, Dr. Hinyang Hasibong, and her counterpart in the Primary Healthcare Development Agency, Dr. Betta Edu, pay an unscheduled visit to one of the construction sites of the Ayade Care referral hospital to ascertain the level of work. According to Dr. Asibong, upon conclusion, the facilities will be stocked with world-class equipment.
This is the site for the Ayade Care Referral Hospital. We have one in the senatorial district of Cross River for now. So right now we are building 3 of them concurrently. This is the Etung site, and we have one in Obudu for the northern senatorial district. This one is for the central, and we have the one in Akpabuyo for the southern senatorial district. This is supposed to serve the Cross River State Health Insurance Scheme, like the Ayade Care. We all know about the Cross River State Health Insurance Scheme. It's about making sure that we avoid catastrophic health expenditure, making sure that when you are sick, you can actually access health care, even if you don't have money in your pocket at that particular time. And for a token sum of 1,000 naira per month, you can actually access a wide range of healthcare services.
For Director General, Cross River State Primary Healthcare Development Agency, the initiative is timely as will also accommodate the over 20,000 Cameroonian refugees presently seeking solace in the state.
I think this project is very, very timely for us right now. In Cross River State, there are over 20,000 registered refugees from Cameroon in this area. This particular community where we are standing right now, we have over 10,000 at Ajaso, at Agbekum, and the rest of the environs here. We have these refugees. And so if we do not have health facilities where these people can carry out more comprehensive, complex health challenges can be attended to, then there's a problem on our hands. So we really need this.
As the people await the full implementation of the Cross River State Health Insurance Scheme, the state government assures them of its impact, which will make medical services available to all.
You're watching News Across Nigeria. Coming up, we have an update for you on the explosions in Ile-Ife. Please stay with us.